Across Delhi-NCR, the air is heavy with toxic smog, burning eyes, scratchy throats and air quality indices that have crossed hazardous limits. The choking haze that surrounds us today is not just an environmental crisis, it's a public health emergency. While cleaning the air isn't entirely in our control, addressing challenges that come with such adversity are surely the need of the hour. Hello and welcome to Let's Clear the Air, a public awareness initiative on respiratory health wherein we will try and aim to bust myths and misconceptions around respiratory conditions and encourage early diagnosis, self-care and proactive treatment apt for weather around us. I'm Kritsween Walia. The panel theme, Short of Breath, Think COPD, is a sobering reminder that what may be dismissed as pollution cough or seasonal breathlessness could in fact be a symptom of a chronic respiratory condition, one that silently damages the lungs over a period of time. As we mark World COPD Day 2025, we bring together India's leading pulmonologists so that we can turn the spotlight on a silent yet serious health challenge that affects millions across the globe. Chronic obstructive pulmonary disease or COPD. Why COPD? Because India is home to one of the world's largest populations affected by chronic respiratory diseases. Yet, awareness, early diagnosis and timely intervention remain major challenges. So today, my panelists, who are among the nation's foremost experts on the subject, will help us understand the growing burden of COPD, the myths that delay treatment, the critical role of early screening, and the need for stronger public health policies. We'll also explore how innovation, awareness, and access can come together to give every patient the right to breathe easy. Our call to action through this campaign is very simple and straightforward. Get yourself checked, and to know your lung health score, visit indiaaqi.com. Let's begin this crucial conversation. Joining me today in the studio are Padma Shri Dr. Randeep Guleria, Chairman, Internal Medicine, Respiratory and Sleep Medicine, Vedanta Gurugram. Dr. Deepak Talwar is our second speaker here, Director and Chair, Pulmonary Sleep and Critical Care, Metro Center for Respiratory Diseases, Noida, alongside Dr. Harshal Ramesh Salve, AIIMS Delhi, Additional Professor, Center for Community Medicine, AIIMS New Delhi, and Coordinator Collaborative on Air Pollution and Health Effects Research in India. And we are also being joined by Dr. Jaideep Kokte, Global Chief Medical Officer, Cipla. Welcome, gentlemen. And welcome to the show. We're going to be touching upon this very crucial conversation. And I want to begin with Dr. Harshal. Dr. Harshal, tell us what makes this conversation the need of the hour. Why is it that we need to touch upon this health initiative that needs to be spoken of more, that needs to be discussed in detail, and is the need of the hour, as I began by saying?
Yeah, thanks for having me on the show. When we talk about any public health challenge, we talk about the disease morbidity and the mortality. So as far as COPD is concerned, it ranks third in terms of the mortality. That means the death, overall deaths, it's the third reason for overall death globally also and in India also. As far as morbidity, to patients with COPD currently in the country, it is almost, coming to the 9 million we are talking about, 90 million we are talking about currently. So both in the morbidity and mortality, this is a huge challenge. And if you compare the previous pattern, compared with the data 10 years back, so it is only increasing due to the increase in the various risk factors, be it tobacco, be it air pollution we are talking about, be it other socio-economic conditions. So this is an ever-growing problem. It will going to pose a lot of challenge to the healthcare system in the country. That's why we are talking about. And more important, as a public health person, these are preventable. So when we talk about the disease, we also look into the preventable aspects. So a lot of risk factors which are leading to the COPD are preventable. So that's what it is important to talk about this disease, its preventive measures, and how we can take up as a part of our health system in terms of managing these conditions.
Dr. Talwar, I want to now come to you and ask you, why is it that people often neglect their lung health over and above other parameters? So in case of diabetes, for instance, or a heart problem, you're not going to shy away from visiting your doctor, which is not so much the case here. What are the common myths, misconceptions that must be busted as we deep dive into this conversation?
See, the main symptom is just shortness of breath and cough and maybe a little bit of a phlegm. And these kind of symptoms are common in almost all respiratory diseases, which are even acute, come up with infections or change of weathers and things like that. So everybody tends to consider them as a normal part of life where these kind of symptoms will come for a couple of days and go away. And they tend to ignore it from the perspective that we do not have simple measures like looking at your blood sugars or checking your blood pressure. You need a little more sophisticated and I think highly technical and standardized way of looking at your lung functions, which is a little challenge because neither it is available all the time to everyone, nor it is easily available and interpretable considering that high quality of standards are required for it. So lung function, which is the most important thing to look at it when you have these kind of symptoms, is generally ignored for a couple of years before it becomes almost like a person feels that I need to see a doctor and I need to ask for something for that.
Okay. Dr. Guleria, now let's get back to the drawing board a little. Let's address the elephant in the room, COPD. Tell us, what is it for those wondering still? What risks come with it? And what are those first signs that people must watch out for when they need to reach out to their doctor?
So as the name suggests, COPD means chronic obstructive pulmonary disease. That means you have a chronic disease which causes narrowing or obstruction to your airways, and it's a lung disease. So when you start talking of COPD, it means you have breathing difficulty, it is progressive over time, you have cough which becomes chronic, and you have breathlessness and a wheezing sound from your chest. So it's a disease which progresses over time, and as was said, it's a preventable disease, and that's why we're talking about it, because a number of factors lead to COPD, and what happens is that it causes narrowing of your airways, so you're not able to breathe properly. It damages the alveoli or the part of the lung which takes part in gas exchange, oxygen going from your air to the blood and carbon dioxide coming out. It damages that part of the sacs of the air, and therefore your oxygen starts coming down, less air can go into your lungs, and your carbon dioxide over a period of time is not able to get out of the lungs, of the body, and you start accumulating carbon dioxide. So you start having more carbon dioxide in the lung and less oxygen. Now, unfortunately, it's a preventable disease because the factors that cause COPD are initially they were smoking related, and that's why there was a lot of focus on smoking cessation. Subsequently, we know that there are other factors. One of the common factors which has actually come down was indoor air pollution, biomass. In rural India, in a lot of developing world, people used to cook using biomass, which was either wood, cow dung, and that led to poor ventilated kitchens and young women actually inhaling a lot of pollutants into the lung, and that caused COPD. Now we are also seeing that because of very poor quality air, people who are breathing a poor quality air because of outdoor air pollution, also we are seeing a lot of COPD. We are also seeing COPD which can occur because of infections. Tuberculosis can also cause damage to the lung which can later on lead to COPD, chronic infections in childhood. So if you start looking at all of these are diseases which are preventable. If you make the air better, if you stop smoking, if you're able to prevent childhood infections by vaccination, I think a lot of burden of COPD could come down.
Okay, Dr. Talwar, quickly, if you can come in on the early warning signs that people around patients must watch out for. So typically you would dismiss sometimes cough as a regular cough, or it's okay, I'm going to take a pill, I'm going to be okay, I'm going to do steam inhalation, I'll be fine. But what are those signs that you must not let go of and pick on?
I think over a period of time, the cough and the sputum is associated with some amount of breathlessness. But initially, this breathlessness only comes when you are doing some kind of an exertion. And in a sedentary life, I think climbing a flight of stairs itself is a big exertion for them. And it is mostly passed on as, the body is not used to, you are not doing gymming, you are not doing exercises. So some amount is because of your aging, or it is related to your kind of life you are leading, which is like a sedentary life basically. So these symptoms of cough and sputum and breathlessness, which either don't go away completely or they come and go again, and to some level they sustain, should not be considered as acceptable. So not to accept that aging is responsible for it, not to accept that it's my fitness which is responsible for it, but think about beyond that, and especially if you have those risk factors which Randeep has said, if they are around you, then you are definitely the one which should get this earlier looked into rather than getting it delayed.
Okay, let's talk, Dr. Gulera, about treatment then. Spirometry is gold standard for diagnosing COPD. Why is it underutilized, and where does primary healthcare need to step in to ensure that it reaches as many people, is more effective?
So you're correct, but spirometry is the gold standard for diagnosing COPD, and that is, as we're saying, we should diagnose it early. And a lot of times, if you just look at symptoms, they're very non-specific. So for early diagnosis of COPD, you need an objective parameter. Now it's easier to diagnose, let's say, diabetes or hypertension, because you just do a test and it gives you a value and you can do it.
Yeah.
Spirometry changes with the period of time. Our lung capacity changes with time, and it varies from ethnic population also. So you have to have standards. And then the other challenge is that spirometry has to be done properly. You need a technician to do it. Unlike a sugar which you can do on your own, you have to blow into a machine and it looks at the how much is your capacity, how quickly can you blow in, what is the narrowing of your airways. So interpretation and doing the test are also very challenging and something that needs training. But having said that, it's not that difficult if you are able to train someone to do it, and now we have better machines available. And I personally feel that it should be something which should be available at a primary health level, and it should be part of a screening. When you're doing screening for chronic respiratory diseases or screening for respiratory problem, like you do screening for, let's say, heart diseases, for hypertension, you should also add spirometry as a part of screening, so that you pick up the disease early and you can intervene early. If you are able to tell a person that, look, your lung capacity is already coming down because of COPD or because of smoking, if you quit smoking, it will settle down, it will improve, the fall will become, the decline will not be that rapid, then maybe you could influence that person to really control his disease or prevent the progression of COPD. That is not happening because we're not doing spirometry as much as we should do.
Okay, zooming out further, Dr. Harshal, let's talk about public policies, national screening initiatives that can be induced into our ecosystem, which is going to bring down mortality around COPD. What more can be done?
So we, as a government initiative, we have a national program for NCDs, NPNCDs, where in 2021 we have introduced the COPD screening, at the primary care level. So that is happening, but still there is an issue, as Dr. Guleria rightly said. So we do have the facilities available for diagnosis at the district level. Screening, symptom-based screening is happening. The capacity building initiatives of medical officers, other healthcare field staff for the symptoms of COPD and other non-communicable diseases are happening. So since last 40 years, we are fighting for tobacco prevention, both smoke and the smokeless tobacco. But we have a new enemy with us, which is more invisible in the form of air pollution. To tackle this invisible enemy we are talking about particularly, so there is a lot of scope to create awareness for preventing these risk factors particularly.
Dr. Gupte, thank you for waiting patiently. I have two very important questions that I need answers to. One is, of course, Cipla's initiatives. So patient education initiatives like Breathefree, extensive. Tell us a little bit about how it's being put to use, how it's being ensured that it reaches the masses, in particular rural areas.
As a company, I know that we've supported a lot of initiatives and having more than 1,000 people across the country to actually educate people, create more awareness, what we call Breathefree educators. They are the ones who actually create awareness among people who come to the clinic, screen them with spirometry or other tools to see if they have lung disease, depending on when a doctor has referred to them. So I think this is very fundamental. In addition to that, we also work with a lot of physicians and associations for screening the community. But you can't screen everybody, right? Because it may not be cost effective to screen every person in the community. But if you look at high risk factors using questionnaires or a simple tool like a peak flow meter, you are able to pick up much more COPD than probably would you have otherwise. So similarly, the Breathefree educators play a very important role in actually educating people about the disease, creating awareness about certain risk factors that they should avoid or they should take care of, like winter, for example, what you should take care of. Should we wear a mask or no? Simple things like that. And using inhalers requires a certain technique. So training on the use of inhalers, making sure that they should be taking the treatments properly, what should be certain alerts by when they should actually contact their doctor. Because COPD, for example, does have exacerbations which can come on quite frequently depending on the severity of the disease and the patient and other factors. So a lot of these education is very important in telling patients which breath-free educators, and now through the use of digital route, can actually be done. So I think through the digital route, you can take it far more extensively than what you could do by simply having a person there. So I think it's a combination of having people actually talking to people, patients, 1,000 people doing that, and now using something called as the Breathefree website that Cipla has developed, an app on the phone that has been developed. I think we are reaching several million people rather than simply a few lakhs in the past.
Can you give us an example here? You spoke of inhaler use.
Yeah.
There's a lot of social stigma that comes with asthma, that comes with COPD, in particular usage of inhaler, something as basic, as simple as go to an option.
Yeah.
How is Breathefree tackling
So,
the challenge and overcoming all of these hurdles through education?
Yeah. So I think it's better than what it was maybe 20, 25 years ago, and I'm sure both Dr. Guleria and Dr. Talwar would comment on that. But fundamentally, treatment was always given as a pill or a liquid or an injection. Inhalers were never seen routine, but I think they have picked up mainstream in the last 30 years. But yes, it still comes with its associated stigmas and myths. People think that inhalers are not to be used in the beginning. They should be only used towards the end of the disease. It's a very severe disease. People believe that they can get addicted to inhalers, several such. But I think those one by one as myths are being dispelled. That's the importance of the Breathefree educators and the entire campaign of Breathefree that has been launched, is actually to dispel those myths.
Dr. Talwar, I want to specifically ask you about COPD and asthma patients. What are those basic fundamental aspects that come with these problems, and don't want to call it a problem, but that comes with these challenges for the patients that can be dealt with on a basic level? So what are the do nots that asthma or COPD patients must ensure for their lung health?
Okay, so both the diseases have got triggers basically, and those triggers are different for asthma and are different for COPD, and some of them overlap too. But these are the ones which will put this vulnerable population into sudden worsenings, which are can be life-threatening. So you need to advise all our people, like we need to advise all our patients how to prevent this kind of exposures which are going to make them bad. So even weather change is like that. So we can't do anything about the weather change. So some of them are of course preventable, some of them not. We have enough
But how does weather impact or worsen their situation? And in this scenario where in air pollution, like we've been discussing, there's really no escape. It's invisible, it's all around us. What do patients do in this scenario?
True. So this is unavoidable, you said very rightly, and very important for both the diseases. Whatever airway disease, you are going to breathe in air, and then air, if it's toxic, then obviously it is going to hurt your lungs. And you can't stop breathing, actually, that's not an option. But yes, we use masks. They can prevent to some extent. Mask usage for all throughout the day has its own fatigue value. Everybody cannot. So just trying to use it when you are going out, what time of the day you are going, at that time what is the AQI, when are you exercising, at what time you are doing, is it that the air is better quality at that point of time? All the time it's not that bad. So you need to take precautions. Precautions also would be in terms of at this time you will get a lot of infections. Some of them are preventable. You do vaccinate yourself for them. You have influenza vaccine, you have a Ebola vaccine. Are we really using them enough? No, we are not. So it's basically an overall healthy life which needs to be done. I would say just one thing, everybody comes and talks about my blood pressure is 120/80, my blood sugar is 90, and there they stop. Okay, what's your lung capacity? Nobody knows. Nobody talks about it. Nobody says I have 4 liters of my lung capacity or 5 liters. We have completely forgotten that the most important organ is not measured, all others are.
A little bit of importance, I would say, has been given to the lungs, let's say post-COVID, a little bit maybe.
Absolutely.
Compared to early on, but not.
I would say a lot.
Dr. Guleria touched upon this, Dr. Harshal, just a short while ago, on the several forms, several signs you must watch out for, everything that you can ensure that stays away from you to keep your lungs protected. But for many people who are undergoing some sort of a lung situation, some lung trouble, a lot of these patients are non-smokers, particularly women. And this problem is also to a large extent, as Dr. Guleria was pointing out, limited to household air pollution. what public health campaigns can then lead to protecting this vulnerable group in particular?
Right, and as you say, the numbers almost 45%, COPD are non-smokers, mainly contributed by the environmental tobacco smoke. If somebody else is smoking in the house and the women is exposed to the smoke, cooking fuel, unclean cooking fuel, and also the poor socioeconomic status. We have growing almost 20% urban area is our slum population, where the socioeconomic indicators are poor in terms of the ventilation, in terms of the access to care, in terms of the sanitation and other aspects. So yes, women are at the forefront of its challenge in terms of they are impacted with all the social and the environmental indicators. And they are also not, they don't access healthcare, as a forefront as compared to males. So our intervention should be targeting at the household level, impacting, focusing on the environment, indoor household environment, and improving their health seeking. So identifying the risk factors, identification of the danger signs, and when to seek care. That is most important. Where the care available, nearby your health center, nearby. Now we have the Health and Wellness Center, the SWC under PM Ayushman Bharat scheme. They are, equipped with the, trained medical professional. They are, qualified to do all this spirometry also, assessment of the danger sign, and appropriate referral also. So this sort of awareness regarding the risk factors, dangers identification, and seeking the health care. The more important thing which I feel, the COPD is a chronic disease. So you have to, live with it. So there comes importance of adherence to the medication. We as a person don't want to take pills. Anybody don't want to take pills, but once you are diagnosed with the disease, you don't have any other option. So how we counsel particular patient to take pill, adhere to the treatment, and when to seek care. The role of AI, I will say, the technology is big in terms of the diagnosis and also improving the adherence.
It's not just adherence to medication, adherence to simple prescriptions like inhalers, Dr. Guleria. And we just discussed inhalers, its use, and there is a little bit of a stigma that comes with it. A lot of people refrain from using it or don't use it as prescribed. What is the problem you think there of the several encounters you've had with your patients?
So there are two things. One is the stigma which is attached to inhalers, and the other is the technique of using the inhalers. So the first thing is that a lot of people feel that inhalers, it's easy to take a pill, but inhaler is more visible. And if it's seen in public, they feel that, especially women get conscious that they have a chronic problem, they're being judged that they have a respiratory problem, and they don't want to use an inhaler in public. Secondly, the stigma or the thought process is that inhalers are used to be used when you are very sick. Because if you look at where this comes from, a lot of it comes from cinema, where it's been shown that if the person is very sick, then he's taking an inhaler when he's really at his last stage of illness. Whereas inhalers are something which are the first line of treatment. So that thought process needs to be changed, that stigma needs to be overcome, and the thought process that inhalers are addictive, they are habit forming, all of these are stigmas which gradually need to be changed, and that's why a lot of initiatives have been taken to really make people understand that these are not true. There should be no stigma, and one should not be really, if you are taking insulin injections regularly, you should be able to take your inhalers regularly also. The other part is the inhaler technique. Now initially people were sort of not comfortable because inhalers required a lot of coordination to take it. You had to have the inhaler triggered, and then you have to breathe it in so that the medicine goes deep into your lungs, and you have to hold your breath so that it spreads into the lungs. But with technology coming in, and now having new devices which are breath actuated, which are simpler to use, both dry powder inhaler and meter dose inhaler, the inhalers are becoming better and simpler and easier for patients. They're more patient friendly, and they also give you an idea of how many doses are left, how is your device doing. Some of them even give you a feedback whether you've done it properly or not. So I think with technology coming in, inhalers have become much more easier to use. The techniques are simpler, and the stigma is also going away.
Well, AI really is the buzzword, and we've already used the AI term thrice in the conversation. So let this be the fourth time. Dr. Gokte, tell us about AI-driven technology, and everyone's touched upon it, but really take us through how it's being put to use and where is it that the maximum impact is being felt. Is it diagnosis? Is it treatment? Is it just better access and more information on how you can use inhalers, for instance, something as small and as basic as that?
So I think the most important area where AI is being used is actually in the diagnosis side. We have seen that has been one of the biggest barriers. As Dr. Guleria was mentioning, you need a somewhat sophisticated technique of spirometry. But if you can get people, the right people to undergo spirometry, you don't need everyone to do it. But if you can screen people in the right way and get them to undergo spirometry, that's a big plus. So there are now several AI-based tools which are being developed or actually available. I think there are at least two of them that we are aware of. One of them which we have collaborated with is actually using cough. So if you cough into the microphone of the telephone, depending on the nature of the cough, an AI-based tool can actually pick up and tell you whether you need to do a spirometry or not. Of course, along with that, you have to answer a few questions, but it will give you with a reasonable degree of accuracy that you could be in a red zone where you really need to see your doctor. You could be somewhat in a yellow zone where you probably need to watch and may need to see a doctor, or probably in the green zone that it's like things are fine. So that's one way. Another way that we have been working on is you have a candle which is in front of you on the phone, and you blow into the candle, and the kind of sound waves it produces, the frequencies, actually can be used by AI to again tell you the same thing, whether you should be seeing a doctor right away or perhaps check again, or perhaps you're fine. So I think these are at least 2-3 ways by which one can start screening, and people can do it on their own. I think you touched upon self-management. I think before self-management, you can even talk about self-assessment. Today we check our own blood pressure, we check our own blood sugar. You don't have to really go to a doctor always. You can also do, using these tools, self-assessment of your lungs. It can potentially give you a lung score and tell you whether you are in the green, yellow or the red zone. So I think AI is first playing a very important role in the diagnosis part. As far as treatment goes, I think the adherence part, the technique part, simple videos on your app that can tell you, you can actually have a digital educator telling you how what your technique should be. You can ask questions to a chatbot, which will tell you and help you answer questions. So it can also offer today apps like the Breathefree app, for example.
But a lot of doctors are warning against that.
Yeah,
Don't
so
consider your chatbot as your doctor.
Absolutely, but it has to be done properly with adequate right information and of course with the okay of the doctor. So that's important.
Chatbot or not, don't think twice before seeing your doctor.
Absolutely.
If in doubt, see your doctor. Okay, and as we wrap up this important discussion on World COPD Day 2025, one message stands clear. Every breath matters. COPD may be chronic, but with timely diagnosis, proper inhaler use and cleaner air, it can be managed effectively. From stronger public health policies and early screening to awareness campaigns like Cipla's Breathefree initiative, every effort counts towards building a healthier, more informed India. Let's remember, breathlessness is not normal. So the next time you or someone you love feels short of breath, think COPD and seek help earlier. Call to action through this campaign is get yourself checked, and to know your lung health score, visit indiaaqi.com. A big thank you to our experts for their insights and to you, our viewers, for joining us in this conversation for better lung health and a cleaner tomorrow. Goodbye and thanks for tuning in.